First of all, Jacqui, so why are we changing things?
Okay, so, well, as science changes and life moves on, procedures have to catch up, I guess, is the way to talk about it. Screening is a process, a way of identifying people who are healthy but could be at increased risk of something, and so cervical screening kind of comes into that as well. Available for women between the ages of 25 and 64, and anybody who's registered with their GP will automatically be called and recalled into the programme every 3 to 5 years, depending on their age and everything. That's been happening since about 1988, I believe, when I had a little look back at this, history and all that. It was all much more haphazard and things before, so there wasn't as organised as a screening. So that's a change. That was a one change. The change this time is to do with what's actually looked for in the microscope, as it were. So instead of looking for abnormal cells, they're looking for this HPV, human papillomavirus. Some of you may know that there's over 100 different kinds of HPV, but some of them are what we call high risk or high risk HPV, and they're the ones that number 16 and number 18 specifically, they're associated with most of the cervical cancers. So we know that HPV is I'm getting your habit now of mixing up my words. It's present in 99.7% or something of cervical cancers. So being able to look for the HPV rather than look to see where the changes in the cells are is important. Probably important to also say that when in the old programme we've been looking for the changes to the cells, that doesn't mean to say that you've got cancer. It means that there are changes that could, in the possibility of time, become cancer. So, so that's the big change, really, looking for HPV.
And how easy is it to actually spot the HPV when you are looking at it through the microscope?
They've got very clever people in labs that do that. That's not something for me to do. Obviously, people are trained. They're trained to take the samples that they take. So what used to be called the smear. The sample takers in the GP practice or wherever have been trained. The people in the labs are all trained to do all this sort of work. It's a different way of working for them. They're not looking at abnormal cells as such, they're looking for the HPV virus.
So when it comes to the actual procedure, what difference are women going to see?
Absolutely nothing. When it goes, you'll still get your letter inviting you to go for cervical screening. So you'll go to wherever you would normally go to. The procedure will be exactly the same. What changes is the results letter, really, when you get that. So you could get one of 3 letters of results or possible results. So instead of looking for the cells now, as I say, what they're going to do is look for HPV. So the first test they'll do is looking for HPV. If there's no HPV found on your test, that's it. You get your letter to say, no HPV found, see you again in 3 years' time or whenever your normal checkup is going to be. If HPV is found in the lab at that point, that's when they'll then look and see if there's any change to the cells as well. And if there's HPV and change to the cells, that's when they will call you for colposcopy and have a closer look at the cells. And I've forgotten the second letter, which is the important one as well, sorry. So the second letter would be HPV positive, but cytology negative. So if your cells look normal, but you've got HPV, all that happens is you'll get a letter saying, come back, we'll check it in a year's time. Which sounds a long time, I know, for people, but it's HPV. HPV, human papillomavirus, very common. Most women will get rid of it within a year. So you just go back for a check of that. Remember, you haven't got abnormal cells, so there's nothing even suggesting that you're going to get cervical cancer in the future. It's just that you've got HPV and you've got that followed up. Does that make sense?
Yeah, it's really good to have the whole sort of process explained, actually, because I'm sure for many women, under the current system, if they got a letter to say that there had been some changes to their cells, they would have automatically panicked. But as you said, that doesn't necessarily mean that anything sinister is going on.
Yeah, a screening test is just that. It's a screening test. It's a way of trying to find women at risk of certain things, in this case cervical cancer, or people at risk of illness, and in this case cervical cancer. So by going a step before you get to the abnormal cells, by going with this HPV, that's a step before you've even got that far. Most women will clear HPV within the by themselves. Their normal immune system will kick in, get rid of it, and then a year later it'll be negative, and see you again in 3 years.
So will the process of getting your letter take any longer because of this now?
No, it shouldn't do. It'll be exactly the same.
And as I said, we are ahead of the UK in this. They're bringing it in next year.
Yeah.
So it's really significant that.
Yeah, we're lucky. The labs here in Nobles were relooking. Well, the programme changed how the labs in England work for checking out cervical screening. So the knock-on effect was that we needed to find the lab that would undertake this work for us. So they've negotiated with the Liverpool Clinical Labs, I think they're called, because they're one of the centres that are doing it, and they're rolling it out earlier. So we get in early on that. So Scotland are going to be the latest. I think they're scheduled for 1920. The rest of England, it should be rolled out by the end of next year.
2019 even.
19 even.
But the key thing here when it comes down to it is women need to go for their cervical smears in the first place. And we've talked about this several times on the show and tried to encourage people to go. Interestingly and quite worryingly, I think there was something in the news recently about how actually figures are still very low for people going to get their smears. How on earth can we convince women to go and...
It's a worthwhile thing to do. I think the fear of finding cancer is what frightens some people. The fear of what you're looking for. But as I've tried to explain, you're not looking for cancer, you're looking for changes that may in the future become cancer. And with HPV, you're not even looking for that. You're looking for the bug that may in the future cause you to have the problem. So hopefully that reassures people. I have to say, I was so nervous coming in here today, ladies. I know you've done your best to put me at ease and all the rest of it, but I was more nervous coming in here than I was going for my cervical screening.
Oh, that's a lot for us, isn't it?
So I know that it is nerve-wracking, and nobody likes going and getting these things done. But actually, it's over in no time at all. And the gain that you get out of it, knowing that you're healthy, is maybe the thing to focus on.
And if people do have any specific concerns about the actual procedure, then talking to somebody, the doctor, nurse or whatever, might help alleviate those.
Yes, certainly. We have really good uptakes in the Isle of Man. Our rates don't seem to have had the negative effect that they've had in parts of England. And maybe that is because we're a smaller community. We know who our nurses are. We go and talk to them at the clinics that are doing the screening and all the rest of it. So, yeah.